There really is a subtle form of corruption in American healthcare. Who's at fault for this corruption? Quite honestly, it's the doctors, it's the hospitals, it's the hospital systems, it's the insurers, it's the drug companies, it's the lawyers, and it's even the patients. Everybody is at fault for the fact that there is this subtle form of corruption in American healthcare. Everyone is at fault for the fact that the system really is not failing. Quite honestly, failure is the system. We have doctors who want money. We have companies that want money. They give, those doctors give unnecessary chemotherapy in my business. Those doctors give unnecessary surgeries and treatments, unnecessary imaging. They make promises about screening tests that we don't know. Then we have patients who consume too much health care, patients who want things. We have patient families who are unable to accept the fact that their comatose father with stage 4 widely metastatic prostate cancer or widely metastatic lung cancer is dying, and they insist that everything be done. And actually in my book I talk about how I still think I have post-traumatic stress disorder from what I did as a 28-year-old second-year resident to a man who had widely metastatic lung cancer, for whom the answer was, we need to try to keep him comfortable because he's dying. But we kept him alive for an additional 6 weeks. And finally, on the day that he died, I was sitting at his bed, at the foot of his bed, and I realized that he was on a ventilator. So this poor kid from Detroit, and this guy, it would be interesting to know what this guy would have thought of this if he had been able to think, because he was probably a redneck, and I was this poor kid from Detroit sitting at the foot of his bed deciding how much air he would breathe in with every breath, how often he would breathe it, what his respiratory rate would be. We had to put in a external pacer to his heart, so I was about to figure out what I wanted his heartbeat to be that day. And he was on Levophed and dopamine for blood pressure support, so I was about to figure out what I wanted his blood pressure to be that day. Just dial him up or dial him down to whatever we wanted. No quality of life for this. This guy lived this way for about a month, by the way, because his family could not accept the fact that he was dying, and what we should do is try to keep him comfortable. They continuously said, we need to give this guy everything possible. We would say, do you mean everything reasonable? And they would say, everything reasonable is everything possible. And that happens all the time and time again. It's probably happening down the street at Grady Hospital today, that people cannot accept that death is a part of life. Death is an imminent part of life. And so, let's get back to how doctors promise people, and indeed, many of these people can't accept that folks die because we in medicine have subtly lied to them over the years and thought that we can do much more in medicine than we actually can do.